Next, on body work. Wow.
Yeah. I don't want to see.
Yeah, baby.
Can you hear me, Martha? It's just my nose. That's all it is. It's really fast.
I need this operation like another hole in my head.
Want to see them in the mirror? Oh, wait.
This is the captain speaking. Amanda, we're landing.
I can change my face. I can touch your lips. Just like I'm just like you. I'm just like I guess no more.
You can't cover up here. There's no hiding your body here. I think for those of us who do a lot of body surgery, it's a good thing. Physical beauty invites you to look for the inner beauty, and I think that's part of why plastic surgery is so successful.
Youth is desirable because we're all afraid of death. If we see that we look young, then chances are we're defeating the Grim Reaper.
It's time we need to exercise here. One each, one.
Everybody here is beautiful or looks good or they learn how to look better. It's the peer pressure. You know, if everybody around you looks good, you better try to look good.
I cannot stand the fact that I am 22 years old and I have saggy breasts. They're to the floor. I just can't explain it. Gravity just took effect way faster than what I expected. I am so self-conscious about my breasts that I try to cover them up all the time. I'm going to have a breast lift done by Dr. Michael Kelly. How are you today? Good, how are you? Good, good.
What we're going to do is I'm just going to examine you, and then we'll go in my office, and I'll tell you what to expect with surgery, okay?
Okay.
Good. You're the perfect patient. You're going to do great with
I know.
When we look at how saggy breasts are, we look at where the nipple is relative to the crease. The lowest point a nipple can be is at the bottom of the breast, and that's where Jennifer's nipples were.
I'm 22. When I turn, 40, I mean, they're just going to be down to, they're going to be like mopping the floor. I'm a little bit nervous right now. I know. It's my first time going into surgery. My friends, they were a little bit in shock at first. They couldn't believe it. The first thing they said, oh, you don't need that. Wait until you see me without a bra. No, but I'm not really sure if it's my style. You know what? After my surgery, I'll try one on.
Jennifer is very self-conscious. Even within girls, we're in a changing room or, we're trying clothes or we're changing to go out, she always tries to cover herself, even with a bra, because she's so self-conscious of it.
This is something else that I try on after surgery. It affects my dating because I start thinking to myself, well, I can never wear, a strapless bra. I can never wear anything sexy. So why would somebody want to date me when you can have someone else that's dressed in a halter top or is wearing, spaghetti straps or something like that?
Morning surgery, I'll draw on you with a magic marker while you're sitting up.
I had asked Dr. Kelly, well, what if in a few years if I want to have kids, what if my breasts get saggy again? And he said, well, Jennifer, they can't look any worse than they do now.
Does anybody know if Dr. Kelly's son is here? Oh, there he is.
Uh-oh, this is trouble right here. This is Dr. Kelly's mini-me. Do you know what liposuction is?
No.
You don't know?
No.
What do you think your father does all day long here?
Surgery.
What kind of surgery do you think he does?
On their eyes.
On their eyes, yes. He'll do that. What else?
And on their breasts.
On their breasts? What does he do? Does he make them bigger or smaller? What do you think?
He makes them bigger.
Makes them bigger? Can you believe that?
You want some hot wings? No? No hot wings? You gonna stop laughing?
I'm Amanda, and I'm getting a nose job. What I don't like about my face is my nose. The roundness part of it right here, it's not the bridge or anything like that, it's just the right there.
Amanda? Hey there. How you doing? Good, good. Hi, how are you? Come on in.
I'm not trying to change my
a little person, anything like that. I'm not trying to change that I have achondroplasia because I like who I am. It's just my nose. That's all it is.
How you doing?
Hi.
So we're going to do the imaging.
Okay.
Okay, and I want to take some pictures so that I can image you. Let me get my camera. Why don't you come on over here? We're going to have you sit right here. Well, it's kind of exciting, huh?
There.
Amanda Strickland is a high school senior, and she's always wanted to have her nose done. What we want to do is accentuate your eyes, because she's got, I guess, her mom's eyes. They kill her eyes, and she's got your mom's eyes, right?
I got my nose from my mother.
The condition Amanda and I have is called achondroplasia dwarfism, where our body size is normal, but our arms and legs are shorter. Another characteristic of achondroplasia is a bulbous nose.
My mom also had nose surgery when she was 18, just like me. She had it for the same reasons, I guess, just because they're roundness. We have the almost the same exact nose. I look at pictures of her right before surgery, and I'm like, we're the same person.
See, if you feel here, her cartilage is really way up here. Mm-hmm. So there's a limit to how much I can take here.
Right.
Because if I take all this, then this is going to collapse. With patients like that, you run the risk of having retraction, which is pulling up in here. And then it makes the nose look very operated. Can I feel your nose a second? See, a lot of yours is taken, and one of the problems if you take too much, then your breathing is compromised. In her mother's case, she had a little, what appeared to be a little retraction. I was trying to avoid that. If I took out all this, her nose would have no strength. So we'll probably take a good bit of this, enough that you'll still have support, but not enough that it makes it collapse. It's not like there's an expert for doing patients who have dwarfism. It's just you have to recognize certain potential landmines there to make sure you get the right result.
We have some goodies for you today.
Look at this. Wow, those are nice.
These are incredible.
You brought enough?
I don't think so. How about for your office?
That is gorgeous.
I thought these were macho.
That's for me.
Yeah,
Susan has been our florist for years.
There you go.
There you go. You all set?
I'm ready.
You ready?
I'm ready.
I think we got to...
We have an appointment today.
Yeah.
And she's also my patient.
In the business world, we're all fighting against those little wenches that just got out of college. Excuse me.
Hi! How are you?
Wonderful.
Good to see you. Great. Better now after seeing you.
Sorry.
It's okay.
I think when I was a young woman, knocking on doors and opening them, they always opened. I think today, thank God they still open, but not as quickly and not as easily. People love youth and people love beauty, and we tend to want to do business with and deal with people who satisfy our eyes. Seems like my whole face is starting to look angry, and
Right.
I'm not a mad person. I don't want to look mad.
If you said, I just don't like the horizontal lines, then the way to treat that is just with Botox alone. But it'll do nothing to lift your brows, really.
Susan's surgery included an endoscopic brow lift, some fat grafting to the deep lines along her face, and some liposuctioning along her jawline and in her neck. It's kind of what I call the gourmet blue plate special. The way that the brow lift works is like I told you, is we make 4 little incisions. We go in using a little telescope. We're able to lift the brow. The way that that's anchored is I actually place 2 screws in your skull.
Would my brow move anymore, or would it sort of be
You will still
immobilized?
No, it's not immobilized. You will still have some movement of your brow. It's not going to be as much as you have now. In other words, I can't do it because I have Botox in here, but you probably are not going to be able to look angry or as
That's
angry
good.
as you normally do when you
Right.
are angry.
I cannot stand the fact that I have saggy breasts at the age of 22.
Are you ready?
I'm very ready. I have been married for wells, and this is it. Now it's really starting to hit me, and I'm getting a little nervous, and I'm getting a little scared. I'm getting even a little emotional. But we won't be able to do that.
just to see how everybody wants me to be happy. I think that's what, it just makes me realize how, you know, how much my parents and my friends are there for me.
How do you feel?
Nervous and excited, but I'm okay.
Yeah?
Yeah.
How are you? Good to see you.
Same.
You all ready?
I'm ready.
Good, good. What I'm going to do is have you sit up and face here, swing your legs around, and I'm going to draw on you a little bit, okay? In Jennifer's case, her breasts were so droopy that even if I got the worst scars in the world, she's still going to look better, especially in clothes, than not doing the operation. Yeah, just let your shoulders relax. The risks that have been described with a breast lift include loss of sensation, interference with breastfeeding, scarring, asymmetry. I'll probably take out just a little bit of breast tissue here to try and even things a little bit more because you're a little bit smaller on this side than this side. You'll still be bigger here, but we'll just get things a little closer, okay?
I'll get that one more time. Okay.
Alrighty.
Okay.
She's getting the new improved one.
Yeah.
All right.
Perfect ones.
All right, Marco. See you later.
Okay. Bye. Good luck, Mommy. Relax. Okay.
My face.
In Jennifer's case, her breasts were so droopy that, in my mind, even if I got the worst scars in the world, you have another alcohol wipe? She's still going to look better than not doing the operation. See a scissor second, Adrian? What I do with the breast lift is I remove the skin underneath the nipple. We lift up the remaining skin and we shift the breast tissue, including the nipple, up to the new position. And we bring the remaining skin around underneath the nipple and close it. So the skin functions almost like a bra to hold the breast tissue up. Get the cookie cutter. This breast is a little bit bigger, so I'm just trying to take a little bit off to even her up.
I feel very bad that Jenny has to go through this. It's been a major problem in her life that she has been dealing with for years now.
Just like a Christmas package. Give me a fluorochroma pencil. It's the reveal, as we say in our industry. You'll have significant scarring. I mean, we've taken a breast with no scars, and we've definitely put scarring on the breast.
You okay? Just I want the soup and everything.
What time did you? As far as the quality of her scars, that's still yet to be determined.
I'm going in for my procedure tomorrow.
Tomorrow?
Mm-hmm. The children were definitely a big issue. If my face wasn't going to be black and blue, there probably would be a really good chance that I wouldn't have even told them. I know that I've always taught you guys that you judge people by who they are and not what they look like. And I kind of feel like I'm going against that whole idea. What has bothered me all through this is that I have to explain to my daughter why I did this, why I went to such extremes to change my face.
Why would you do it?
Why would I do this surgery?
Yes.
Because I really wanted to stop looking angry, to get rid of the angry lines that are here and here on my face. And then on my forehead, they'll actually lift it. They put a little hole in the top of my head. Yeah, I know, that's the grossest part. And they're going to actually just pull my forehead up a little bit. That'll get rid of all these wrinkles. They're just putting some fat in here, and they are lifting my forehead, though.
Is that going to feel like tight and stuff?
I don't
Probably
know.
in the beginning.
And will it move like your hair like back because you're pushing this?
Probably by a little bit, yeah. Yeah. You okay with it?
Yeah.
Yeah.
What if we said no?
Yeah, I don't know.
Hey, Jared. Hi, how are you? Look what they went.
Look what the cat dragged in.
Yeah, look what the cat dragged in. Huh? Over the past year, I've pierced a few of my daughter's friends' belly buttons, and so I become the belly button guy. My niece, Jalen, is coming today to get her belly button pierced. Did you see your cousin, Jalen?
Yeah.
She's going to come with my brother, Isaac, who is a neurosurgeon. Jared, you're going to pass out, Jared?
Maybe.
Hey, how you doing? So you finally got the go-ahead, huh?
Yeah.
You mind if they're here?
No.
Okay. My two children, Jared and Alyssa, were here to give her a little boost. This doesn't hurt. This is just to mark it. You know what? You have a kind of an off-center belly button, dear.
I know.
You mean you're not perfect? Your dad's always told me you're perfect. Relax. Jared, you okay? Let me see the earring that we're doing.
Do you use something or do you just do it yourself?
I use my teeth. Chill. This is a pretty neat thing, isn't it? This is kind of our own little invention of how to do this. Let's see if we can call Uncle Isaac. Tell him that this ain't brain surgery, but someone's got to do it. That's it, baby.
Oh.
Look at this. This baby went in there.
Oh, wow.
Isn't it pretty good? It's not brain surgery if you put it on wrong. Let me see if I have any more.
Thank you.
You're welcome.
Oh, I'm so happy. Congratulations.
Can I have a fork? Thanks. This is an intense time of my life because school year's ending, graduating, new job, going to school 2 weeks later, friends saying goodbye, parties. Use mine. Mine's really light. See, look. Me. Just very exciting. Very nerve-wracking. Very everything turned into one. What? Oh, God. I don't think Amanda's is prepared for the results as she thinks. The change, seeing yourself in the mirror, totally different person. It's going to be hard to get used to. Well, since it's not bone, it shouldn't hurt as much as... But it's still a surgery. It's true. Have you ever had surgery before? No. I'm a little nervous. Yeah.
Our office florist, Susan, is coming in for a brow lift today. I know her kids were nervous about the surgery, but they finally approved of her getting screws put into her head.
They seem to be really comfortable with it. My daughter's a little concerned with blood and guts and stuff like that, but other than that, I think we're a go. Was Sam okay this morning?
Yeah. I think she was a little nervous, but she'll be okay. Toe rings?
That's it, no toe rings. No belly rings. We just seal it.
With a kiss. Okay, bud. See you in a little bit. Okay, I will.
Where I lift your brow is going to determine, like the shape of your eyebrows, and we don't want to make anything look funny.
Happy's good, funny's
we don't
done.
want, you're right. We want you to have a happy face, but not a funny face.
I think the challenge in Susan's case is that you have to be very, very precise. If you raise the eyebrows too much, you get a very unnatural look, a very surprised look. If you don't raise them enough, then it doesn't appear that you've done anything. So it's really one of those operations of millimeters. 1 millimeter in the wrong direction, you're a loser.
Just like you are, just like
Looks like it's showtime.
The florist for our office, Susan, is getting a brow lift today. The endoscopic brow lift is basically a way to elevate the eyebrows, and it's done by making several little puncture incisions behind the hairline, inserting a telescope inside the scalp, lifting up the scalp area, lifting up the forehead area, removing some of the muscles that create the wrinkles in the forehead and the furrows between the eyes, and then tightening the eyebrows up to an elevated position.
Yeah, Milsey. I need my glasses. And all the lights on. Are all the lights on?
Yeah.
Wait. Hey.
Once we've elevated the eyebrows to the proper position, we need to fix them there until the skin adheres back to the skull. And we do that by putting several absorbable screws right into the bone of the skull, and then putting some absorbable sutures from the scalp and from the forehead area actually tacked to those absorbable screws.
I need this operation like another hole in my head.
In Susan's case, we removed some fat from her inner thigh. We processed the fat and we injected the fat into the deep furrows that extended from her nose down towards her mouth that were getting deeper over the last 5 or 6 years on her.
Your operation's all finished, okay? You don't care?
That was really fast.
Yeah, we did. We did it on high speed.
She may look a little different. She's smiling. That's a good thing. Hey, sleepyhead.
Everything went okay?
Yeah, great.
Yeah?
Yeah. How do you feel? You got a little bit of a headache?
A little bit.
Yeah?
But I feel good.
That's normal.
I think it hurts a little bit to have a couple of holes drilled in your head.
Thank
you
you
just
very
rest up,
much.
okay? We'll see you a little bit before you go home.
Okay.
Okay.
I used to weigh 262 pounds. I had gastro bypass surgery. Now I weigh about 150 pounds. I had a bit of flab on the skin, a lot of things that kind of hung around on me. First we did the breast implants, and then after that I had a tummy tuck, and then I did the facelift. Now I want to do the extra stuff here on the arm. Waddle, I don't know what to call it. It's a flippity-flap in the breeze, and I don't want it to flippity-flap anymore. That's not pretty. My name is Martha Schaldiner. For fun, my husband and I would go motorcycle riding.
She's proud of who she is and what she is. She's not an old grandma.
I still sometimes see myself as being quite large. I don't always recognize myself. I'll come out of the shower and there's a big old mirror and I thought, oh, that is me. But I don't think that my transformation is complete.
Hey!
Hey!
How are you? You look beautiful.
Thank you.
You really do.
Good.
You look great.
He always gives me a big hug and a kiss on the cheek.
My wife thinks he's adorable. He don't do nothing for me.
Let me look at you, and then we're going to go sit down and talk.
Okay.
Martha Schaldiner had all this excess skin that she wanted me to deal with. You all ready?
I hope so. I think so.
Good. One thing that's not so nice about this particular procedure is that it leaves scars on the back of the arm that basically run from the elbow up to the armpit. We close the incisions with some dissolvable stitches. I'm always hesitant to do that procedure because you've got to decide that having those scars is a better look than having all that excess skin.
I'm a little apprehensive. I'm going under general anesthesia.
Bye-bye. Take care.
But I will probably get very nervous the day off.
So what's on the menu?
I'm not going to tell you.
You're not going to tell me?
No.
It's a secret? It's a secret?
Today, Algerine, who calls herself Dr. Herman's mom, is bringing lunch.
It's a secret. How come you won't tell me?
9. Let's get out.
Alderine Wada, she's just a very, very positive person.
When I first saw her, I was like, okay. They look exactly alike.
It's my mom. Okay, fine. She is staying so. She is.
She's a patient of mine from many years ago who is a breast cancer survivor who had breast reconstruction.
I'm going to the doctor today.
What's wrong?
He says I have a little blockage.
Like a little pregnant?
What does that mean, a little blockage? I think this is too hot for me. What do you think? Not too hot?
No.
She makes hot sauce that is so hot that it will take the paint off your car.
What do you think? You're making me sweat.
Well, this is some good stuff.
This is a real deal here. We got to keep Dr. Wolf away.
Maybe it's killer.
I need a boy? You think so? Nice boy. A nice boy. How do you get a boy? Is there some kind of thing I got to do special to make sure it's a boy?
Eat hot food.
Eat hot
food? We're operating on Amanda Strickland today. She's a very cute young girl who's going to have her nose done. Hello, how are you? Hey, how you doing? Hello, nice to see you. Okay. So I was looking at your picture last night, and tell me what it is that you don't like, and then we can talk about what I was thinking.
Just around this.
Around it. It comes down?
It just how it's around.
Amanda has a bump, and she's got a very wide tip, but her tip is problematic because the cartilage of her tip starts out way high. Her cartilage actually goes up like this. And in order to open it, when we're talking about the opening incision, is if you do that, you have a chance of having a really significant retraction.
Right.
Which would really be unattractive, and that's not what we want.
I can my face.
We're operating on Amanda Strickland today, who's going to have her nose done. She has very fragile bones, so I have to be really careful to avoid collapsing her nose.
There's some stickers here, okay?
Open your mouth. This is oxygen, okay? Keep that in your mouth. You need to relax.
See, Gracie, look. Her cartilage is here. So all this to here is skin.
Okay.
So if you do anything there, what happens is then you can potentially get a retraction like that, which is awful. She's got very, 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 very small bones.
Really?
Very short, very short. When I went to break her bones, her bones were like little shells. They were very thin, very, very delicate. It was almost like I did it with my fingers as opposed to the chisel. Now that the tape is holding down the skin, it takes the contour of the underlying structure. And what you do is you get to see roughly what it's going to look like. You may want to see this picture. See the difference here? This is all gone. Amanda, don't move, dear. Amanda, we're almost finished. Okay, now, so would you make sure her head... Amanda, wait a second. Amanda, we're putting the cast on. Hold on. Amanda, this is the captain speaking. We're about to land. We're landing. Amanda, we're landing. Amanda, we're landing. Amanda, open your mouth. Surgery's over. Amanda. Maybe she'll recognize me. Amanda. It's over.
Good morning. How are you guys?
A little drowsy.
Oh, that's okay. That's to be expected. Right this way.
I wish that there was an operation which didn't involve as extensive scarring as the one we have.
Okay, Jennifer, so did you sleep last night?
Yes, I did. I slept a lot better than what I expected.
Oh, that's great. All right.
I was worried about the post-surgery, how she was going to feel. I didn't know what to expect after the surgery.
I have so many mixed emotions about the surgery. I am scared. I'm hoping that this will change my life around to just appreciate myself more.
Have you seen them? You want to see them in the mirror? Now you're swollen and, you know, everything else, but that's going to go away.
They don't even move. Well, that would correct.
I think that would feel better, more normal. That's what she said anyway.
They don't feel like breasts. That's for sure.
It's not even 24 hours yet. So I think you're doing very well. Considering.
I feel like there are two rocks there.
Always get nervous the last minute.
Yeah, but you're a trooper. This is like nothing.
I know.
Piece of cake.
I still get nervous.
I can understand. Stay under there if you're cold.
You gonna
tuck you in. It's getting close, and I'm probably a little edgy and a little bit nervous. I'm not very religious, but I always, ask God to look over everybody and make sure everything is okay.
How you doing? You all right?
How you doing?
Couldn't be better. You know what I'm going to do is have you sit up for me here. Put your legs on that side.
Okay.
And I'm just going to draw on you, okay? My favorite part. Coming back once more.
Do your magic.
Yeah. All right.
There. You're going to start breathing in and out, in and out.
Good girl.
Surgeons are a rare breed. To be a successful surgeon, you have to be an egomaniac. You have to be the guy who thinks, I'm the only one who can get this done. Can you raise the table, please? The brachioplasty surgery involves removing a section of skin and fat and closing things up afterwards. I think that we'll be able to decrease the circumference of her arm probably by about half. Why don't you help me get started here, Flavio? So it's going to be a pretty dramatic change for her. Let me have 2 4 inches and 2 3s. The surgery leaves scars on the back of the arm that basically run from the elbow up to the armpit. All right, thank you, everyone.
Martha. Hey, open your eyes. Can you open your eyes for me?
Heart attacks, strokes, blood clots, wound healing problems, infections. The likelihood that they're going to have one of these complications increases greatly as you get older.
Martha, your operation's finished, darling. How are you? Can you hear me, Martha?
My face.
Open your mouth. Can you open your mouth? Wide open. Okay, good. Open your mouth.
Martha, how are you? Yeah? Your operation's finished. Deep breath.
The likelihood that they're going to have complications increases greatly as you get older. Martha proves the idea that you can't just generalize based on age. She has healed every operation that I've done fantastically.
Dr. Kelly will be back to see you in a minute.
Rhinoplasty surgery, Emma Kelly speaking.
Emma, my daughter, has been interested in surgery since she was little. The last couple years, she's been asking me to come to the practice, and if she knows she has a day off from school, she wants to come. She likes watching surgery, she likes being there in the office, she just enjoys the whole experience.
3 o'clock. Is that good? Okay.
You didn't get her name.
You got enough, okay?
Patients who have endoscopic brow lifts have a significant amount of swelling to their face and eyes.
How are you? Good. How are you?
Feeling today?
Better.
Looking good.
So we don't even like them to come in the next day because we don't want them to scare the other patients.
Hey, who punched you?
Yeah, my husband.
I know, that's okay. How do you feel?
Good.
How's your headache?
Good. I still have a little bit of a headache.
A little bit. We're going to leave the staples until next week.
So my face doesn't fall off.
Right.
Yeah.
I hate when that happens.
I have this vision of it going,
Yeah, you know, if it falls off, make sure you bring it back and we'll staple it right back on.
Don't make me laugh too hard.
2 days ago, you were probably really swollen.
Oh my gosh, I was. I couldn't fit my face in my hands to wash it. It was very odd feeling.
But it goes
My daughter was shocked. I mean, it must be a terrible way to see mommy. I still wonder if I should have let them see me. I look like a cross between a chipmunk and a raccoon.
Okay, as long as you don't smell like a skunk, we're
That
set.
would be bad.
Yeah, that'd be bad.
Wow.
I think you got yourself a new nose. Look, it's gonna be great.
Don't you feel like $1 million?
I don't want to see.
Oh, yeah, baby.
Looks like he got beat up with a bat.
Yes. Oh, no more.
Hi, how are you? Good.
That thing's about to come off.
I know. Thank God. I can't wait to go off to college with my new look, my new nose. I'm an easy patient. What can I say?
It's been great so far. Oh, that was too hard. Wow. It looks awesome.
That's cool.
Wow. I think you got yourself a new nose. Look.
That's awesome.
Let's bring up.
Amanda's surgery initially was very stressful, but when I did it, I saw that it was going to be a really nice result because everything fit just right.
New nose for new school, new place to live. It's gonna be great.
I'm really happy with it. I really like it.
Wait for a month when you come back and be like, look at my new nose. It'll be good. Bye, Amanda. Take care.
Thank you. When I look in the mirror after my surgery, I like what I see a lot. I really like my new nose.
Think it's all gonna fit?
I do. I am going to college today.
You need a bigger trunk.
Now I'm going off to a brand new place with a brand new nose, so can't wait. First I didn't know how it was going to turn out, and I was a little worried that it'd be a little too pointy or small, but it came out perfect, better than perfect. My nose now is sleek, very elongated than it was before, not as round. The best thing about my new nose is that it's what I wanted. It's exactly what I wanted.
For everything. See you later.
Bye.
We'll be back.
You.
I'll call you when I get there.
Love you. Love you
Hey!
Hi.
How are ya?
I'm doing good.
Good. How are you? Doc? Let's take all this stuff off and look at everything.
I'll turn my head now.
Yeah.
I don't want to see. Of course, I keep looking.
Right. I don't want to see it, but I'm gonna
keep my nose stuck in.
Sneak a peek.
Yeah.
How about that? That's great.
Do I need to raise?
Oh man, what a difference!
Yeah, I can't see any hang down. I thought they looked great. I just kind of went, wow. When I look in the mirror, I see smaller arms. I think my arms look better. I feel better about them. I'm very happy with my surgery.
Oh yeah, baby, that's gonna look great. You come up great.
Riding on the motorcycle now, if I raise my arm, I don't have the flap flopping in the breeze anymore. And it's nice.
Hey, you know what, Sam? Do you know that I actually have screws in my head? Did it hurt?
Yeah, afterward it hurt for sure, when I woke up.
When I first saw you, it looked like you got beat up with a bat.
Yeah, I did, didn't I? I'm very, very happy with the results of my surgery. I got exactly what I asked for, so I couldn't be any happier. I'm thrilled. I think having the surgery definitely has something to do with my job and wanting people to have that confidence in me. I think beauty definitely is power. Now, when I wake up in the morning or when I just catch myself in the mirror, I look, to me, the way I feel.
I think Sue looks great. I think we really nailed this one. Made her look a little bit more youthful. I think she's really happy with this.
Wow. Are we talented or what? Congratulations. I think we did a good job.
Well, thanks for your help. You did great.
It's really completely different.
You look beautiful.
Thank you very much. Thank you for being there for me.
You're welcome. Very proud of you.
It was a really good experience.
I do not have saggy breasts anymore. I'm a proud owner of perky breasts.
Wow. You look beautiful.
I know. I'm feeling pretty darn good. I look at them a lot. I mean, I put on different shirts and different tops to see how they look, and I'm just like, wow, you know, I could never wear this before, and right now I'm actually fit, like, perfectly. It's a very good feeling. I'm just a much happier person. Everybody at work is like, you're so nice to everybody. What's your problem?
Now, tell me the truth. Don't you feel like $1 million?
No, I feel good. First time I see you with a tube top.
How are you?
Look what I got. Hello.
Can I take it?
You can take me. You can take
steal
me.
you?
Or you can steal me away. Get me out of this madness here. This place is crazy today. If I don't come back, it means that her company took off and I'm retired.
He's gonna be Mr. Mom.
I'm gonna be Mr. Mom. I could stay home, watch Oprah, watch a little Jerry Springer, do a little shopping. I could handle that for a while. I think I'd last about a week. What do you think? Bye, guys.
Bye.
Bye-bye. Bye. Bye, guys. Bye.
I can change my face. I can touch and taste. Just can I erase? Just like with a little swan. I'm just like you. I'm just like. I'm just like you. I'm just like. I'm just like you. I'm just like.